Good afternoon. My name is Ian Ropek from New York, and I am a member of the Education Committee. I'm excited to welcome you to From Whitewater to Smooth Sailing, Best Practices in PT Compact Implementation. This session will include a moderated discussion with the three chairs of the Physical Therapy Compact Commission. They will share the challenges and successes in implementing the Physical Therapy Compact, including an overview of the current state and future direction of the PT Compact. The speakers for this session are Kathy Arney, Troy Costalis, Corey Tillman-Wolf, and Jenny Lattimore. Troy, Kathy, and Corey served as the first three chairs of the PT Compact Commission. Jenny serves as staff to the PT Compact Commission. You can find their bios on the event app. They have valuable information to share, and we also encourage your participation. If you wish to ask questions during the Q&A portion, the members of the Education Committee will provide you with a microphone. Please abide by the ground rules in the program notebook so more attendees have a chance to ask questions. At the end of the session, please scan the QR code to complete your evaluation. We really value your feedback. And now I turn the presentation over to our speakers.
All right, good afternoon, everyone. We're in the home stretch. Thank you for joining us today for today's conversation on best practices in PT Compact implementation. As Andrew said, my name is Jenny Lattimore, and I'll be guiding our discussion with our panelists. The format today is kind of a relaxed. Think of it as more of a coffee table style talk. I'll be posing some questions, and our speakers will share their insights and perspectives, and we'll just keep it conversational. Then I'll highlight some of the resources that may be of interest for both compact and non-compact states. And then we'll open it up for audience questions at the end. Okay. But first, let's hear a little more about our panelists. So this is how the PT Compact looked when Troy Costalis of Oregon first became chair of the PT Compact in 2017. Troy, tell us a little bit about your involvement with the PT Compact.
Good afternoon. Troy Costalis from Oregon, citizen member at that point in time for our state PT board itself. And there was conversations going on nationally about the initiative of the potential of a compact set of language. So I got a chance to be involved in the working committee that talked about the theoretical and programmatic side of what a compact might mean. And then was invited back to represent Oregon in the actual drafting committee for the language that was then proposed to be adopted and looked at across the country. You can say my background. So, spent 38 years in public service for the state of Oregon, 25 of those as the executive director of the Highway Safety Office. In my responsibility of 3 different governor-appointed committees that I was the executive director for. And I'd also spent earlier at the governor's request 10 years on the Oregon Real Estate Board as a citizen member, 2 years as vice chair, and been involved with the Oregon PT board as well. And Oregon was the first state to adopt the language for the compact, and was asked to represent Oregon when the PT compact came to existence, and was elected as the first inaugural chair. Got to work with some phenomenal people all the way along during that time, and that created the creation of it that we are in at that time of our history.
Thank you, Troy. Yeah, lots of experience in regulation. Kathy Arney of North Carolina then became the second chair of the PT Compact in October 2019. As you can see on the map, a whole lot more blue states, or states became dark blue. Kathy, can you briefly tell us about your involvement with the PT Compact?
Sure. At that time that North Carolina participated in the inaugural meeting to stand up the commission, I was the executive director for the North Carolina Board of Physical Therapy Examiners. And I had the good fortune to be elected as the vice chair at that time. And one of the best practices I think that we started out with pretty early, but that's thanks to Troy, is that because of his experiences with other compacts, the vice chair and the chair met regularly with the compact administrator. And so what Troy said and what we discussed, I was able to hear as well. And so then that benefited me when Troy ended up rotating off. So I've been on the executive board for 2 years when I ended up becoming chair.
Thank you. And then finally, Corey Tillman-Wolf of Virginia was chosen by the PT Compact Commission to be its third chair at the end of last year. Corey, tell us about your involvement in the PT Compact.
Sure. So I'm Corey Tillman, I'm the Executive Director for the Virginia Board. And just as a little bit of background, I became the Executive Director for that board in 2016. And literally within the first month that I was at the office, we had a work group on the PT Compact. And so I had to learn very, very quickly what in the world this PT Compact was. And I had to learn the language, the requirements, what the financial impact would be. And so over time, Virginia then became member state number 20 after we introduced legislation from the board in 2019. We became active in 2020. And at that point in time, I was fortunate enough to be able to become a representative on the PT Compact Executive Board as a member at large. And from there, I was able to learn from the best. I was able to learn a great deal from Kathy Murray, from Jeff Rosa, our compact administrator, and over time, I was able to then feel comfortable with the compact, really get a feel for it, and then become chair last year in 2024, filling some very big shoes. So, and I have a lot of fortune to work with great individuals, including Jenny, on the day-to-day administration from the executive board perspective.
Thank you, Alice. So just in case you weren't aware, this is what the PT Compact map looks like now. We're at 40 member states, 35 of which are actively issuing compact privileges. So you can see how much growth we've had in the last 8 years. So we would now like to get a sense of who is in the audience and what you're hoping to get from today's session. If you have yet to participate in a Slido poll in this meeting, I don't know how that's possible, but this is one of your last chances. Scanning there, it'll be on the next slide as well. So for this first question, we'd like to know, what is your jurisdiction a member of the PT Compact? All right, 26 respondents. We got 62% are active members. Okay, at 35 folks, we got actually 29% who are not members, and some member but not yet active states. Okay, thank you. What concerns currently exist in your jurisdiction regarding the PT Compact? None. Wow. I want to talk to you. Capacity. Infrastructure, yeah, yep. Logistics of implementation, yeah. Data integration. Only serves border communities. The process of it. Legislator getting the language correct. Right. Implementation, legislative support. Lots of different types of responses here. Let's see another implementation. Legislature isn't keen on compacts right now. Data collection. All right, the last two people. All right, thank you all. Compliance and education of the public about privilege holders. All right. For jurisdictions who are currently members of the PT Compact, describe your jurisdiction's best practices in implementing the PT Compact in a few words. So essentially, for the PT Compact member states, what would you say has been successful in your state in terms of implementing the PT Compact? Involved staff, yes. They're getting the PT Compact to run in your state will require a lot of board staff involvement and engagement. get legislative support for it. Follow directions. All right. Got several great staff involvement. Some people have the technology API for it. Taking our time, learning from others. Yes, absolutely. FSBPT, I'll highlight that. Yes, we are a resource. Thank you all. Hopefully you'll get some additional insights and actionable items from our panelists today. And then finally, what are you hoping to learn from this presentation? And I'll update on new developments, okay? Tips on joining the compact. Yep. Definitely going to cover best practices of implementation. In-depth understanding. The available resources. How to use FSBPT grant funding. How you accomplish something this big. We'll cover a little bit of the history there. How do I describe a compact to my students succinctly? We'll cover that. What potholes might we encounter being a new state implementing? We got 2 states here who have experience in doing so, so we'll get some information from the panelists later. 2 more people typing. All right, thank you all. All right, so let's get into it. First question for our panelists. What is a compact and what motivated the need for a compact? What was the, what problem were the states trying to solve by creating a PT compact?
So the basics of a compact is when there's established set of language or legislation that is then common and used in multiple jurisdictions without amendment, without editing, so that there's a common floor from one area to the next. Most of us in this room participate in a compact and probably don't even know it. This is a little bit what Kathy was kind of poking at me to say from my background. There's this thing called a driver license compact. You cross the state border, you don't need a technical test. Now, there are different rules of what you have to do, speed limits, seatbelt, motorcycle helmet, cell phones, things like that. But the bottom line is that there's a minimum floor across this country of what testing goes through for a driver license. So the whole idea behind creation of the common compact means is that we have something that is now in 40 states that have a common expectation. This arose out of conversations here. Some of you in this room, some of you that are in your chair prior to you, about the fact that there was a lot of inconsistency. There was a lot of inaccuracy in some cases when information may have passed from one place to the next. I know both of you were involved in some of those early conversations, sometimes formal, sometimes just meeting in the hall or talking over a cup of coffee.
So some of the additional concerns, I think, at the time for states, which are concerns today, and that is, pressures about licensure portability, and do states have the means to enable licensees to move around and for licensees to be accessible to patients. There were both state and federal concerns about regulatory boards, as there are now. Some of them, the perceptions that regulatory boards are guilds and represent barriers to entry into the profession. And I think one of the situations that the compact solves is that this common state of regulations still enables the laws in each state to exist. And they're not changed. Your current law is not changed other than you agreed to enter into this agreement about licensees being able to obtain a privilege in another state. And without the rigor of having to go through licensing applications in the way that they do now. I think one of the other requirements that the PT Compact helps minimize for licensees is that you maintain one home state license where your permanent home is, and then you can obtain a privilege in every other state you want to be involved in, minimizing. Some people have 10 physical therapy licenses, and this way you would pay for one home state, one set of continuing competence requirements, and then you can, more flexibly obtain a privilege to practice in another state. So there were a lot of things that were going on at that time, and as the development language moved forward, some of those concerns were addressed.
All right. Can you tell us a little bit about the process for developing that compact? What sort of opposition did you face? How did you get buy-in from legislators, as the audience was asking about, and states and other stakeholders?
So, two ways. One, to mention earlier, there was the working group that FSBPT hosted initially at their office to bring in experts from other compacts that are out there, particularly the EMS area and what they had been going through. And there were representatives from all over the country invited to come forward and talk about what are some of their concerns, what they're hearing, related to financing, related to discipline. How do you know where the licensee or the privilege holder might be if something was to happen? Who handles that case? And actually had a multi-day conversation trying to think through programmatically and then marking down realistically how do a lot of those things occur. And I'm very appreciative of all of the wisdom that was brought into those conversations and for the hosting of that, and also the mix of people that were in the room. A licensee, a citizen member, but I happen to have a background in a lot of the regulatory side of things and infrastructure, laws, rules, and how those things nest with each other. So each of us with different expertise were able to at least have some sense of agreement of where this should be heading and how do we rise above these items to make sure that they're taken care of, that we have the ability all across this country for legislative bodies to raise their hand, the governor signing on as well through that legislation to say we can do this, and not create something that is lopsided or one-sided and pits parts of the regions of the country against each other. Locally, we were very fortunate in the state of Oregon to have legislators that are in the medical field, saw some of these concerns, rang true for them personally, and took up the mantle of saying that they were willing to sponsor and bring the conversation forward, to be the host, to be the facilitator of the conversation locally with work groups and within committee and sponsoring and hosting legislation themselves. And we had a board that was very much involved and engaged and staff for the PT board that were knowledgeable, understood the data, understood, to mention multiple licenses in what states do people come from, and the traveler concept that was more common at that particular point in time. So there was a lot of things that all lined up. At times felt like may have been the vaudeville act up on stage with the sticks and the plates, and trying to keep things all going and not realizing sometimes someone showed up behind you, put a new stick to plate that you needed to worry about, but had participation amongst all those partners in order to keep things moving, keep things positive, and having that legislative champion and champions plural was an enormous moment that moved things forward, because you could have just as much as a champion, you could have people that are just detractors that take away from some of that conversation.
I think that echoes some of the themes from the meeting about collaborating with getting the right people at the table to move things forward.
Jenny, I put one other thing I want to add. One of the big motivators for FSBPT in participating in this is that some of the requirements in the model language are that we agree that we're going to share data with the the general database, which we shared with the Federation. And so, you heard this weekend about the exam licensure and disciplinary database. Well, part of what member active issuing compact states have to do is share data at least weekly with the Federation. And you report your disciplinary actions and investigative cases to this database. And then that information is in turn able to be shared with other member states, which allows your state to have that information when you're making decisions about licensure. And so one of the things that Jenny will share is just how that's affected the ELBD over time. So I wanted to make sure that we mentioned that as a motivator to create
The PT compact, excellent. For Kathy and Corey, at the state level, once the PT compact commission got stood up, what kind of barriers did you run into in the early implementation phase? In terms of the best practices, what sort of steps did you take to prepare to overcome those barriers of implementation?
So in North Carolina, we did not yet have the FBI criminal background check, and that process was not as difficult as I thought it might be. It's primarily filling out an application, but it's more understanding where that application goes and what they're trying to look at and whether they can approve it. Initially, the compact language, model language, has something in there that enables you to obtain the FBI criminal background check, but our FBI did not believe that that was sufficient. Fortunately, we had another law that was already in place. We just didn't happen to be using that at the time. So they eventually approved it. But I do know other states have some difficulty with obtaining that initial FBI approval to obtain criminal history record information in order to make decisions for licensure. We also did not have the same level of robust database within our office as we do now. So I think that those are the biggest implementation challenges. But then the third one, which also relates to this database issue, is that we believe from the very beginning that compact privilege holders should be listed on our website because they do have the privilege to practice physical therapy in the state in the same way that your licensees do. So we didn't have a mechanism for that. And it was almost like we had to create a little mini application for a privilege holder so that they could get into our database and complete the jurisprudence exercise, which we also require in North Carolina. So there were things that I think we didn't know that we were going to need to do. So it did take us quite a while, but we got there. And now with the advent of the grants, I think it's able to help people speed up that process quite a bit.
Yeah, and on the Virginia end, I will add, I mentioned a little while ago that when I started in my role in 2016, I had to immediately hit the ground running and learn what this thing was that was the PT compact. And so for some of the newer administrators in the room too, you may be able to relate. We had, our previous executive director had been pretty involved in the discussions and drafting of language related to the PT compact. And I came in completely new and having to figure out what this agreement was and what it entailed and what the concerns were that we had to think about at the state level. Now, and somebody mentioned it perfectly with the Slido poll a little while ago, which was taking time and learning from others. And that was really one of the benefits that we had on our end, was that we were able to watch North Carolina and see North Carolina's experience. We were able to see what some of the other states were facing in terms of challenges. And we also had the benefit too of within our umbrella agency, with the Nurse Licensure Compact, although it was a different model overall, it was a great opportunity to see what some of the implementation issues might be related to criminal background checks. And so we were able to really piggyback off of their lessons learned as well. And so we had a little bit of a unique perspective in our or a unique pathway, if you will, because we were able to really sit back and learn, understand what the financial consequences may or may not be. The Virginia board was actually able to actually pursue the legislation itself. And in doing that, we learned about the criminal background check issues that were coming up and starting to become a little bit more prevalent at the time. So we were able to build that into the legislation and kind of head that off at the pass. We were also able to add, just some language to alleviate legislator concerns about FOIA, for example, without any changes to the overall compact language itself. And so really that ability to learn from others, have those discussions, was really critical for our ability to adopt the compact. And so I definitely talk about that as a best practice. Those conversations are critical. At the time, there was a model about the financial impact that had been put together by Jim Hyder from Oregon. And that was absolutely critical in terms of answering questions of legislators about what the potential fiscal impact would be to the board and whether there would be a significant impact on licensure revenue. And so those were some of the early things that we overcame early on. But again, it's those connections, those conversations, the support of the Federation staff and the compact administrator. Those were all very critical, and I certainly encourage that for states considering adoption as well.
I wanted to go back to the financial concerns for just a second, because I think there was discussion about there was going to be this big loss of revenue because your endorsements would go down and it was all going to be replaced by compact privileges. And that's just not how it plays out. I think what it does do now is that people have options about how they choose to obtain whatever the practice, the certification, or whatever it is to practice physical therapy in your state. And some people still want the license. Some people prefer the practice privilege that the compact offers. And so I would really strongly encourage people who are worried about the finances to either get a hold of Jim's initial, sort of rubric about how to go about thinking about it, and then try to look a little further down the road and say some what-if scenarios, so that learning from other people, because it did not play out the way that maybe the worry was, and it's played out differently. Yes, our numbers have changed in the amount of each type of license in North Carolina, but we still are. The belief is that while there might be less revenue as a result of how much we're charging for a compact privilege, the benefits and the value that then, we're talking about the value proposition all along here this weekend, the value that it's added and the preparedness that North Carolina has when there's a pandemic, when the military, there's a federal law that says that the military have to be given some kind of privilege to practice in your state right away. It's there, it's ready to go. And so whatever the next thing is that comes along, we're ready to go there too. And the more states that join, the easier it will be for that movement.
All right, thank you. We're going to move on to the next question. So we've seen significant improvement in state participation, as mentioned in the Exam Licensure and Disciplinary Database, the ELDD, since the start of the PT Compact. Kathy kind of mentioned what requirements are for compact member states because they become a member. What value do you think the PT Compact has provided for the states, or even for the general public?
Sure. And so, and I believe as Kathy mentioned, one of the early motivators was enhancing participation in the ELDD, and really the stats have really shown that the compact has helped with that overall. We have many more individual states that are providing licensure information, that are using FSBPT ELDs, reporting those disciplinary actions. And so I think overall, this has been an absolute enhancement to the ELDD as it stands. And so that has certainly been one of the main benefits that we have seen on our end. Also, I want to point out too that there are a number of non-member states that are members or that do provide information to the ELDD. And so if your state takes that extra step of becoming a member of the compact, you've already checked off a number of those items on the proverbial implementation list that exists for the information that you need for participation in the compact.
So speaking about value, as many of you in the room probably know, the SDRA, that is something that all of us need to comply with because it's a federal regulation. Military members are needing to be able to move quickly, get working quickly. Military members and spouses. In North Carolina, it's also extended to veterans and veteran spouses. And so, as long as that regulation allows the PT compact to be one of those options, depending on requirements in that law and what your state requires, we have that in place. And so we have several pathways by which a military member can come to North Carolina and get working really quickly. And so that is a big value. I know we've talked a lot about storytelling. Well, we do tell the story that it increases access, but I don't know that we've honed it well enough that I can tell you exactly in what areas of the state. It's not just cross-border. There are a lot of travelers that come to North Carolina because we have a lot of rural areas that are not well staffed. And so clinics, hospitals, home health, they're hiring people from other places on a temporary, maybe hopefully to engage them permanently to see patients in North Carolina. And so that really has been a benefit. And the reverse or the flip side of that is I know that because we've had some complaints about that too. So, but there is evidence that it does increase the access to patients to have physical therapists and assistants available.
All right, we'll do one more question. How can state boards stay engaged and impactful after joining the PT Compact? What are some tips for effective state participation?
From the very beginning, one of the things that the compact is you have a liaison from your state board to the compact, the ability to participate in public meetings, making them available not just in person but also virtual. And so there is the link to that particular avenue to stay engaged with what's going on. We've got folks, Jeff now getting involved as far as staff to be able to help. I would like to say that the APTA was very much involved in a lot of the lobbying and legislative work around the country. Board of directors for the Federation, Bill yourself, very much involved in the early beginnings of the conversation. It's still all plugged in. And it seems like the conversation around compact and what it means, there's a lot of individuals that are out there that have a touch point and can share where they had a question, but also where they know, if they don't know, where you might be able to go to get an answer. Just a matter of making sure you raise your hand. But formally, you have that liaison to the compact from member states.
And I just want to also put in a plug for committees. That is one area where the compact has worked over the years to not only strengthen engagement with member states, but also to really leverage the volunteers and the strength of the volunteers that we have within the organization, within the member boards as well. And so that is a great way to be engaged, to really hear more and see more in terms of what the compact does, and also raise questions and concerns, or also provide ideas about education outreach and how to, if you're having these questions, how to answer those questions for other boards as So I do want to just put in a quick plug for if you're interested in volunteering for any committees, then that is certainly a great way to be engaged and become engaged in the activities of the compact.
I just want to add a couple more points about value and engagement. And I think because the compact can touch a lot of different areas that regulators either interface with or affect, the PT compact gives you a place to start with developing relationships and conversations. So we've already talked about ABTA, but we also had to engage with payers. Early on, there was an issue with whether payers were going to pay for physical therapy services for privilege holders. And the compact, the FSBPT, and a whole host of other occupational licensing boards jumped in together and addressed that at the national level. And, sort of what happens at Medicare kind of trickles its way down into other private payers, and indeed that's what occurred. So a license is considered equivalent to a privilege, and thus those services should be eligible for reimbursement. So we're able to interface with the federal government. I see some educators out here in the room, opportunities to talk to students about all kinds of things, moving between states, job opportunities, ethical behaviors as you move from one state to another. So the compact has offered a lot of opportunities.
Thank you, Troy, Kathy, and Corey for sharing your insights. Hopefully you're able to get even the seed of, some best practices for implementation. I'm gonna, before I get into the Q&A session, I just wanted to briefly review some resources we have available for both compact and non-compact states, which it sounds like people are interested in. So first is this resource packet for board staff that was developed by the PT Compact Education Committee. As you can see, the packet includes a checklist of checklist and how-to guides for how to do some of the administrative tasks that come with becoming a member of the PT Compact. The resource packet also includes examples of emails and newsletter articles that you can include in your board communications to licensees about the PT Compact. There's also a PT Compact PowerPoint presentation, complete with speaker notes that the board can use to present to PT, PTA education programs. Currently, these materials have only been shared through the FSBPT portal to PT Compact Board Administrators, the PT Compact Board Administrators Group, and the PT Compact Delegate Group. However, the plan is to share this with the CBA, Council Board Administrators, so that non-compact states can also access that information. Next is the newly updated PT Compact website, particularly our resource library. So this information is available to the public. So for the board staff in the room, you can certainly direct folks to the website when they ask you for more information. The library includes a lot of guidance documents for a lot of our common questions like, what's a home state? What do I do if I'm moving and changing home states? As a military member or a military spouse, do I qualify for a PT Compact? Things like that. The resource library also includes webinars related to the PT Compact. One I want to highlight, which sounds like might address somebody's question here, is a webinar on how some states started using an API to include compact privilege holders on their state licensure book. We had 3 states share their experience with the process of doing that, so definitely check that out. For the educators, the resource library includes instructions on how to access the free PT Compact module for educators, which was made by educators for educators to teach at their PT and PTA programs. This is good information for both compact and non-compact states, because as you know, some students who are getting their education in non-compact state might get licensed and move to a compact member state. We also have the FAQ on our website. That can be a good resource for board staff who handle a lot of inquiries about the PT Compact from their licensees. I'm just going to highlight the category of illustrative scenarios, which gives examples that may be helpful for folks who want to know if they are eligible given their XYZ situation. And then coming soon, we're gonna add a help desk, our help center to the website where essentially, you put in a search term and all the articles related to that will come up. And then finally, as mentioned by the panel, your best resource is each other. So leverage the administrator or the delegate compact group or the CDA group in the FSBPT portal to ask each other how you're handling certain questions regarding the PT compact. Kathy, actually, you mentioned this. Somebody, there's one state who asked about an issue with insurance companies not accepting compact privileges as a legitimate license, and then another state provided a resource document in response. So use each other as resources. But now we'd love to bring you all into the conversation. What questions do you have? Oh, we got one over there already for our panelists.
Sean Begbie, Indiana. This just goes off of a conversation yesterday in the internationally trained PT group that was in the afternoon. In compact states, can we ever envision a way of where the internationally trained PT is not having to re-credential in every state? Where if a compact state gives privileges as their home state, that it transfers to other states without having them to go through the administrative burden on our part plus the provider's part.
If I'm understanding your question correctly, if an internationally educated applicant obtains a license in a compact state,
That is their home state.
yeah, that's their home state,
Yeah.
they can obtain a compact privilege in another state by application. And your only limiters there are really, are you eligible for it? Meaning, do you have any disciplinary
I
action,
guess-
that kind of thing?
I guess I'm communicating it wrong, I'm sorry. So if they've already gone through the process and they're licensed in a state, but let's say they move from Indiana to Texas. They've changed home jurisdictions. They've already gone through this process and they're moving from a compact state to another compact state. Is there any way to eventually change the rules where we could open that up to not put them through the administrative burden a second time?
I'm not so sure that that's really a compact directly related question, but I do think because of the compact, people are able to move without having that scrutiny on their credentials to obtain a privilege. And so by example, is that what you're saying?
I'm just trying to figure out a way that kind of uses the tools that we already have in place to lessen that burden. If I move, it's not hard for me to do it. I don't have to re-go through my transcripts, everything else. Maybe take another course in something I don't need to, right? I'm just trying to envision how can we get to a better level of that. And I might be totally wrong. I'm just trying to think through this.
I don't know that we're gonna be able to get around the, if you move from one home state to the next home state, needing to get a license in that new jurisdiction. But one thing I can say too, and I don't know if anyone else in the room has experienced this, but as we have regulatory reviews, I feel like with the compact over time, there has been a little bit more of a, ungripping the steering wheel, if you will, in the sense of understanding, well, if we're looking at our requirements and what might be barriers for licensure, if we've already got a compact and you're already, having practitioners come into your state by virtue of a compact, sometimes it has changed the discussion a little bit to really increase the willingness to look at some of those other requirements. So that's just something I've noticed over time.
Another question in the back?
Rudy from Oregon, just wanted to follow up with what Corey has said. So I was part of the Rules Advisory Committee because it actually used the PT Compact, and for Oregon, there was less barriers because there was one particular rule that required a letter from the employer to check the good standing of political status. So if it's more for a compact, the argument was course, it was easier to enter Oregon through the compact. And why do we need this additional rule that presents a barrier? So that's the only pathway that I could see, because I see compact as completely different domain as endorsement.
It looks like we had a
Yeah, I
question
just
here.
moved from California. You mentioned a little about limitations like insurance companies, maybe not accepting the compact. Are there other things to be mindful of as educators or people wanting to get a compact that you ran into so far?
One thing I can think of off the top of my head is people who, usually we want people to be very efficient, get your application requirements done quickly, and people that are moving to states and then changing their driver's licenses immediately, but are then struggling with, are they really eligible for, the license or the privilege in another state? And sometimes that's been an issue for some. I don't know. What
I will just echo that there seems, at least for PT Compact staff, there seems to be some people who just have a misunderstanding that a compact privilege is not a replacement for licensure by endorsement. You have to qualify for the compact privilege to be able to get it.
Troy was just mentioning, potentially, if there's a pending disciplinary action in a case and they're moving to another state. But if you get a disciplinary action on a license, that's, then you become ineligible for a compact privilege and all your privileges go away.
We have a question there?
Erica Sherman, Michigan, you're not a compact state, hopefully we're a slow to adapt state, so hopefully we will be at some point. But I do a lot of advising for grads that are asking questions about compact, so I apologize for this being a fundamental, basic level question, but for, you have your home state license, then you apply for a endorsement to the compact, or is it per state? And then what about CEUs with that endorsement, that compact privilege? Do they have to do CEUs that align with all of those states? Can you just speak to that? I apologize, I know it's basic level, but.
Sure, that's no problem at all. That's exactly why we're here. So really it's based on the home state too, and getting that initial license where it's kind of your entry point to the compact. Your home state license has to be a compact member state. From there, you then can purchase the privileges for the other compact member states as well. You only, though, have to complete the continuing education requirements for your home state. That's the only state where you have to hold the active license. You would then renew your compact privileges based upon your expiration of your home state license. And so that's a great question. Happy to answer a little bit more about that too. I do put in a plug for the educators module and the PowerPoints. It has some great materials for kind of talking about what those scenarios would be, because I know students also have a lot of questions about, well, if I live close to a border, which is my home state address? Can I use my practice address? Some of those questions can be answered through some of those materials as well.
We're running a little bit low on time. If you haven't done the evaluation already, please go ahead and do so, but I know we have a question over here.
Paul, Homeless, Florida. We know we're pending language, but Florida, for the longest time, we have it as a statute that if you failed the exam 5 times, you can never, ever practice in the state of Florida. So I don't know if that language is going to be changed by the legislature, but it's been a long-standing law in Florida for physical therapy and the assistants.
In terms of response, I would say that if Florida joins and people are then obtaining a compact privilege in Florida, you can see on the fsbpt.net how many times they've taken the exam, but that's not going to change whether they are allowed to obtain